An overactive bladder. An overactive bladder, also called OAB, creates a common and sudden urge for urination that can be difficult to control. You may feel like you need to pass urine several times during the day and night, and you may experience an unintended loss of urine, urinary incontinence. If you have a serious illness, you may feel embarrassed, isolated, or reduced to work. The good news is that a short test can determine if there is any reason for your symptoms of an overactive bladder. You can manage your bladder symptoms with simple behavioral techniques, such as dietary changes, time-lapse methods, and bladder control techniques using your lower back muscles. If these initial attempts are not helpful enough for your extra liver symptoms, additional treatment is available. Symptoms: if you have a bad one, you can feel the urge to urinate, which is hard to control. Feel an unintended loss of urine immediately after an urgent need to urinate. Urgent inactivity. Always urinate, usually 8 or more times in 24 hours. Get up more than twice a night to urinate. Nocturia. Even if you are able to get to the toilet at a time when you feel the urge to urinate, frequent and unexpected urination at night can affect your health. When to see a doctor. Although uncommon in older adults, an overactive bladder is not a normal part of aging. It may not be easy to talk about your symptoms, but if they are stressful or disturbing to your health, talk to your doctor. Treatment is available that can help you. Causes: normal bladder function. The kidneys produce urine, which is secreted into your bladder. When you urinate, urine passes through your bladder through a tube called the urethra, rhetho. The muscles in the urethra, called the sphincter, open up to excrete urine from the body. In women, a urethral opening is found just above the opening of the vagina. In men, the urethral opening is at the end of the penis. As your bladder becomes full, sensory signals sent to your brain eventually trigger the urge to urinate. When urinating, these sensory signals direct the relaxation of the lower pelvic muscles and the urethra, urinary sphincter muscles. The muscles of the bladder tighten, contract, expelling urine. Reduction of one. Dislike overactive bladder occurs because the muscles of the bladder begin to contract uncontrollably even if the urine volume in your bladder is low. This inaccessible access creates an urgent need for urination. A number of conditions can contribute to the symptoms and signs of an overactive bladder, including emotional disorders, such as stroke and multiple sclerosis, diabetes, urinary tract infections that can cause symptoms similar to those of an overactive bladder, hormonal changes during menopause in women, abnormalities in the bladder, such as tumors or stones in the bladder, contraceptives, enlargement of the prostate, constipation, or previous activities to treat other forms of uncontrollability. Other things that may be associated with your symptoms include medicines that cause a rapid increase in urine production or require you to drink plenty of water, excessive use of caffeine or alcohol, rejection of mental retardation due to aging, which can make it more difficult for your bladder to understand the signals it receives from your brain. It's hard to walk, which can lead to an emergency if you can't get to the toilet immediately. Incomplete urination, which can lead to symptoms of overactive bladder, as you have less urine storage space left. The cause of some overdoses may not be known. Risk factors: as you grow older, you are at greater risk of developing an active bladder. You are at greater risk of diseases and disorders, such as an enlarged prostate and diabetes, which can help with other problems with bladder function. Many people with depression, for example, those who have had a stroke or Alzheimer's disease, develop an overactive bladder. Uncontrolled reactions to such conditions can be controlled by fluid schedules, expired and reactivated, inoculated clothing, and intestinal systems. Some people with an overactive bladder have bowel problems. Tell your doctor if this is a problem for you. Problems: any form of self-control can affect your overall quality of life. If your liver dysfunction symptoms are causing any health problems, you may be emotional stress or depression, anxiety, sleep disorders and sleep cycles, sexual problems. In some cases, treatment for these associated conditions may help with your urinary symptoms. Women with an overactive thyroid may develop a condition called unprotected intercourse, in which case urgency and uncontrolled depression occur. Uncontrolled stress is the unintentional loss of urine caused by physical activity or work that puts pressure on your bladder, such as coughing, sneezing, laughing, or exercising. Uncontrolled treatment of depression will not help the overactive symptoms of the bladder. Similarly, overdose treatment is unlikely to improve symptoms of depression. Some people may have a combination of bladder problems and bladder problems. The bladder can cause great urgency and incontinence, but it does not detoxify properly. A specialist can help you with this combination of bladder problems. Prevention. These healthy lifestyle decisions can reduce the risk of an overactive stomach. Maintain a healthy weight. Get regular exercise, and get some exercise every day. Reduce caffeine and alcohol consumption. Stop smoking. Treat chronic conditions, such as diabetes, that may contribute to symptoms of overactive bladder. Learn where your genital muscles are and strengthen them by doing Kegel exercises. Tighten, bark, muscles. Hold a 2-second cut, and relax the muscles for 3 seconds. Work on holding the cut for 5 seconds and then for 10 seconds at a time. Do 3 sets of 10 repetitions each day. An overactive bladder diagnosis. If you have an unusual urge to urinate, your doctor will check to make sure you do not have the virus or blood in your urine. Your doctor may also want to make sure that you urinate completely when you urinate. Your doctor will look for indicators to offer. Your nominations will include medical history, physical examination, which may include a rectal examination and pelvic examination in women, a urine sample to test for infection, blood clots, or other abnormalities, focused sensory testing that can identify emotional problems or abnormal thinking, test performance of another. Your doctor may order tests to check how well your bladder is working and its ability to ejaculate firmly and completely, urodynamic tests. These tests usually need to be referred to a specialist, and you may not be required to make a diagnosis or start treatment. Urodynamic tests include measuring urine left in the bladder. This test is important if you have concerns about your ability to urinate completely when urinating. Inflammation of the bladder, urine left behind empty, can cause symptoms similar to those of an overactive bladder. To measure urine residue after closing, your doctor may request an ultrasound scan of your bladder. An ultrasound scanner translates sound waves into an image, showing how much urine is left in your bladder after urination. In some cases, a small tube is passed through the urine and enters your bladder to excrete residual urine. Measuring the rate of urine flow. To measure the volume and speed of your voiding, you may be asked to urinate into a device, urine. The uroflowmeter captures and measures urine, and translates data into graphs of changes in your flow rate. Bladder pressure test. Cystometry is a test that measures the pressure in your bladder and surrounding area as your bladder fills. During the test, your doctor uses a small tube to fill your bladder lightly with warm fluid. Another catheter with a pressure gauge is placed in the rectum or, in women, the vagina. The sensor tells us how much pressure your pressure should take to fully discharge. This procedure can determine if you have non-invasive muscle contractions or a solid bladder that can keep urine under low pressure. Your doctor will review the results of any tests with you and recommend a treatment plan. Treatment. A combination of treatment strategies can be the best way to eliminate the symptoms of an overactive bladder. Treatment options. Behavioral interventions are the first choice in helping to manage an overactive bladder. They usually work well and have no side effects. Behavioral interventions can include examination of pelvic floor muscles. Kegel exercises strengthen your pelvic muscles and the urinary sphincter. These tightened muscles can help you to prevent conflicts of interest from one another. Your doctor or physiotherapist can help you learn how to do Kegel exercises properly. As with any other exercise program, Kegel exercise works best for you depending on whether you do it regularly. Biofeedback. During biofeedback, you are connected to electrical sensors that help you measure and receive information about your body. Biofeedback sensors teach you how to make subtle changes in your body, such as strengthening your pelvic floor muscles so that when you have a sense of urgency you can better compress them. Healthy weight. If you are overweight, losing weight can reduce symptoms. Weight loss will be followed by fatigue and constant tiredness. Scheduled private tour. Setting up a toilet system, for example, every 2 to 4 hours, puts you in a position to urinate at the same time every day rather than waiting until you feel the urge to urinate. Endless catheterization. If you can't remove your bladder properly, using a hose from time to time to remove the bladder completely helps your bladder do what it can't do on its own. Ask your doctor if this method is suitable for you. Suck pipes. Wearing protective pads or underwear can protect your clothes and help you avoid embarrassing incidents, which means you will not limit your activities. Absorb clothing comes in a variety of sizes and absorbency levels. Training 1. 1 training involves training yourself to slow down when you feel the urge to urinate. You start with a slight delay, such as 30 minutes, and gradually work your way up to urination every 3 to 4 hours. 1 training is only possible if you are able to strengthen, worship, your spinal muscles effectively. Medications after menopause. Treatment of a woman's genitals can help to strengthen the muscles and tissues in the urethra and genital area. Vaginal estrogen comes in the form of a cream, suppository, tablet, or ring, and can greatly improve the symptoms of an overactive bladder. Bladder remedies can help reduce the symptoms of overactive bladder and reduce episodes of uncontrollability. These drugs include tolterodine, Detrol, oxybutynin, which can be taken as a pill, Ditropan XL, or used as a patch, Oxytrol, or gel, Gelneek, Trospium solifenacin, Vesicare, Darafenacin, Anablix, Fesoterodine, Toviaz, Mirabegron, Myrbetriq. Common side effects of some of these medications include dry eyes and dry mouth, but drinking water to quench your thirst can increase the symptoms of an overactive bladder. Constipation, another possible side effect, can increase your bladder symptoms. Extended doses of these drugs, including a skin patch or gel, can cause a few side effects. Your doctor may recommend drinking a small amount of water or sipping a sugar-free piece or chewing sugar-free gum to reduce dry mouth and using eye drops to keep your eyes moist. Over-the-counter preparations, such as biotin products, can help with prolonged dry mouth. To avoid constipation, your doctor may recommend a diet high in fiber or the use of sewage. Bladder injections. Onabotulinum toxin A, onabotulinum toxin A, also called Botox, is a protein derived from the bacterium that causes botulism. Used in small doses injected directly into the bladder muscles, this protein restores the muscle. Studies show that it can help reduce severe stress. Short-term effects usually last for 6 months or more, but repeated injections are needed. Side effects from the injection include urinary tract infections and urinary retention. If you are considering Botox treatment, you should be willing and able to relieve yourself in the event of urinary retention. Emotional stimulation. Controlling the sensory nerves in your bladder can improve further liver symptoms. One procedure uses a small wire placed near the sacral nerves, which transmit signals to your bladder, where they pass near your tailbone. This minimally invasive procedure is usually performed with a temporary wire insert under the skin on your lower back. It can sometimes be performed as a high-level procedure in which a permanent electrode is inserted and a long-term test is performed. Your doctor will then use a handheld device attached to the bladder to deliver energy to your bladder, similar to what the heart does for the heart. If it helps with your symptoms, a permanent, battery-operated pulse generator is surgically installed to help control the rhythm of the nerves. Percutaneous tibial nerve stimulation, PTNS. This procedure uses a thin needle inserted into the skin near your ankle to send electrical energy from the net to your leg, tibial nerve, into your spine, where it connects to the nerves that control the bladder. PTNS treatment is delivered once a week for 12 weeks to help treat the symptoms of an overactive bladder. You will need nutritional treatment every 3 to 4 weeks to keep symptoms under control. Surgery to treat an acute bladder is reserved for people with severe symptoms who do not respond to alternative therapies. The purpose is to improve the ability of the bladder to retain urine and to reduce pressure on the bladder. However, these procedures will not help reduce abdominal pain. These processes include surgery to increase the volume of the bladder. This process uses pieces of your intestines to replace part of your bladder. This surgery is only used in cases of severe trauma that do not respond to any other conservative treatment. If you have surgery, you may need to use a tube from time to time for the rest of your life to remove your bladder. Removal of another. This procedure is used as a last resort and involves removing the bladder and surgically constructing a bladder, neobladder, or a hole in the body, stoma, to attach a bag to the skin to collect urine. Lifestyles and home. These lifestyles can reduce the symptoms of liver dysfunction. Maintain a healthy weight. If you are overweight, Losing weight can reduce your symptoms. People who survive and are at high risk for urinary incontinence, which can be improved by weight loss. Drink sufficient amounts of fluids. Ask your doctor how much fluid you need each day. Drinking too much liquid can make your symptoms worse, but not drinking enough can make your urine more concentrated and can irritate your bladder. This increases the desire to urinate. Limit foods and drinks that may irritate your bladder. Other foods and beverages that may irritate the bladder include caffeine, alcohol, tea, carbonated beverages, citrus juice and fruit, chocolate, spicy foods, and tomatoes. If some of these symptoms are getting worse, it may be wise to avoid them. A different tree no compatible or alternative therapies have been proven to be effective in treating overactive bladder. Studies have suggested that acupuncture may help reduce symptoms of overactive bladder. Surgeons treat you using extremely thin, disposable needles. The accompanying treatment options may not be covered by insurance, so check with your insurance company first. Dealing with support living with another overworked can be difficult. Consumer education and consumer support groups such as the National Association for Continence can provide you with resources and information online, connect you with people who find an overactive bladder, and encourage abstinence. Support groups provide an opportunity to express concern, learn new coping strategies, and are encouraged to maintain self-care strategies. Educating your family and friends about the worst in your experiences can also help you build your support network and reduce feelings of embarrassment. When you first start talking about it, you may be surprised at how often the situation gets worse. Preparing for your appointment in the worst-case scenario, you may first need to see your primary care physician. After your initial appointment, you may be referred to a urologist, or physiotherapist for diagnosis and treatment. Here is information that will help you prepare for your appointment, and what you can expect from your doctor. What you can do: keep a diary for a few days, and record where, how much fluid you consume, when urinating, even if you feel like urinating and experiencing intolerance. A diary can help determine why you should get up and urinate at night. Tell your doctor how long you have had your symptoms and how they affect your daily activities. Be aware of any other symptoms you may be experiencing, especially those related to the functioning of your intestines. Let your doctor know if you have diabetes, have coronary heart disease, or have had hip surgery or radiation treatment. Make a list of all the medications, vitamins, or supplements you take. Many medications can affect the function of another. Write down the questions you will ask your doctor. For one that is overused, basic questions may include: what are the causes of my symptoms? Is my urine clear? Am I properly draining my bladder? Is my lower waist strength good enough for me to keep my bladder from getting in when I have an abnormal appetite? Are there any other tests you recommend? Why? What therapies are available, and what do you recommend? What side effects can I expect from treatment? Are there any dietary restrictions? How do some of my health problems affect my bladder symptoms? If I need to see a professional, what can I expect? Is there an alternative to prescription drugs? Are there any brochures or other printed material that I may have? Which websites do you recommend? What to expect from your doctor? Your doctor may use an overused blunt questionnaire to test your symptoms, asking questions such as these: how many symptoms do you have? Are you leaking urine unexpectedly? How much? Do your symptoms prevent you from doing what you love to do? During daily activities, such as walking or bending, do you leak urine?